Just to start things off, Dr. Misal, could you tell us a little bit about yourself?
Yeah, and then thank you for having me. It's a pleasure to talk to you guys about sickle cell trait and about its relationship to kidney cancer. I am a medical oncologist. I see mainly patients with kidney cancers. And when I'm not seeing patients and running clinical trials for new therapies for mainly kidney cancers, I'm also a cancer biologist and I do lab research related to kidney cancers. And basically, we're trying to understand why certain kidney cancers happen and how can we best treat them? How can we find new therapies and new ways to treat these patients?
Absolutely. And so I know you deal with, kidney cancers overall, but what draws you to sickle cell trait and specifically, I guess, the topic of this discussion, RMC?
Yeah, so I'm originally from Greece. That's where I was born and raised and did my medical school. And in Greece we do have a population of Greeks with sickle cell trait and disease. But I also, at the same time, when I moved to the U.S., I trained in the Bronx, where I did my internal medicine residency there, and that's where I really got acquainted, with the sickle cell community. There's a strong sickle cell community in the Bronx. But it was my mentor, Nizar Tanir at MD Anderson in Houston, who really infected me with, his enthusiasm for kidney cancer in general and renal medullary carcinoma, abbreviated as RMC in particular. Once you take care of a few patients with RMC, you can never forget them. It's such a devastating disease afflicting a young, vulnerable population that, it drives a passion in you to try and help out as much as possible. So that's how I got myself involved in this field.
Got it. And what exactly do you do, specifically with these patients? How can you tell us, I guess, about your line of work and, more about
Yeah, so we have a group of people and a group of researchers and clinicians who try to help out patients with rare kidney cancers such as RMC. In our group at MD Anderson, we see approximately, myself as well, about one new patient with RMC every 1 to 2 months. And we see those patients either here or we hear about double that number from all over the world. And, we try to the best of our abilities to help out physicians and patients from all over the world as well that might be dealing with this rare cancer. It's rare. It's extremely, extremely rare for, people, physicians, even in the community or even in some academic centers, but it's not as a rare cancer for us. And so that's one of the things that we do. I run clinical trials dedicated to RMC, the only clinical trials to date that were specifically designed and dedicated to patients with RMC. And in the lab, what we're doing, we have a group of researchers that are trying to understand why RMC happens and what makes it tick, and how can we kill it? How can we help those patients eradicate this cancer from patients that have it? And also, how can we hopefully one day prevent it so that no patients and their families have to suffer from this disease ever again? So that's our goal, and that's our mission.